Okay, here's our first critical thinking question for Chapter 9. Why is it important to code both the disease and or disorder and the organism responsible for the disease process? Well, this is one of the basic coding guidelines. Code completely. Without further defining the organism, the coding is rather vague. Now, in some situations, this is all the documentation will support. However, in certain diseases, it's rather significant if the patient has a disease due to a Staphylococcus aureus infection versus AIDS. Depending on the codes used, the principal diagnosis may be different, or a complication and or comorbidity might be added or deleted. The MSDRG may also change as well, therefore impacting reimbursement. Physicians use the terms sepsis, septicemia, urosepsis, bacteremia interchangeably. How does a coder distinguish what the physician actually means? Well, the answer to this is, on the basis of the actual definitions, think of each stage as getting more severe. Bacteremia is simply bacteria in the blood. The patient has no symptomology and it's typically a transient state. Septicemia is a bacterium in the blood causing systemic disease. It's more significant than simple bacteremia. Once a patient has progressed to SIRS, the body begins a systemic response to the infection. The patient may have fever, tachycardia, which is fast heartbeat, and leukocytosis, which is a low white blood cells shown on a blood test. Sepsis is SIRS due to infection. In this case, the septicemia is coded as well as the systemic inflammatory response syndrome. If organ failure occurs, that is also coded as a secondary diagnosis, such as respiratory failure or kidney failure, along with the original codes of 0.038.XX and 995.92 or 995.94. If any of the documentation is unclear, it's very important to query the physician and provide the definitions to the physician for accurate code assignment. Okay, and our final question. In what situations might a coder want to wait to query the physician? Well, the answer to this is sometimes the physicians may clarify a diagnosis on his or her discharge summary. It might be advantageous for a coder to query before a discharge summary is dictated and then ask the question he or she has to be clarified in a discharge summary. In some cases, the results, such as a culture or radiology report, may not have been available until after the patient was discharged. In this instance, the coder can then relay the results to the physician in the query and have him or her clarify the results in an addendum to the progress notes or discharge summary.